So here you can see the ST segment depression. As I mentioned on the left, if you know what your normal PQRST is supposed to look like, then if you see something abnormal, then it could mean that the person has some underlying heart disease. So you can see that the ST segment is what's called depressed. So it's sort of a, lower, and it's also on a slope. And so that is something the cardiologist will look at. As the person who's doing the exercise test, it's really not your job to say. But if you see something like that, again, the cardiologist is often in the room or possibly close by if they're doing any testing. So oftentimes the technician can't say anything, but that would be something that would be looked for during exercise. What about heart attack? Someone, so we mentioned about people having chest pain. So someone feels they have chest pain, but if someone feels they're having chest pain and they're having a heart attack right now versus chest pain that comes and goes, that might be evaluated with an exercise test. If you walk into the emergency room and you say you have chest pain, they're going to get you an ECG right away. So that's one of the first things they're going to check, is to see if someone is having a heart attack right now. So if you look at A, this is your normal ECG. What happens in most heart attacks, now there are heart attacks where the ST segment does not rise like this, but that's, very uncommon. Most of them involve what's called ST segment elevation. So if you remember on the previous slide, the ST segment was depressed. Look at this one, it's really, really up in the air. So that is very obvious that something is wrong. And so they will also do things like take blood and look for cardiac enzymes. So they'll do the ECG in combination with cardiac enzymes. So that definitely looks abnormal based on what you know from the normal PQRST. And I remember when, my father had a heart attack, over, 20 years ago. I knew enough at the time, even though I just had my bachelor's degree, when I saw that ECG, I'm like, yeah, he really is having a heart attack at that time. And then you look to see how the ECG changes over time. So that ST segment starts to come back down. And if you look at the description on the slide, it says hours to days. So it does start to come back down. So say somebody didn't go to the ER right away, they came and they were in this phase. So again, they would still take the person in and get them evaluated. And then days to weeks, you can see the T waves on both of these are also upside down. And then E, weeks to months after a heart attack. So you can see there's sort of that ST segment becomes flattened out. So, and that's maybe, again, at least 6 weeks, could be longer. So if someone's maybe not had an ECG in a while, because lots of times people have to go for an ECG, they have some sort of surgery. They'll just make them go and have some pre-op tests, and especially if you're going to have anesthesia, they'll have you, do an outpatient ECG. So, say the last time they had a normal ECG, and then their ECG looked like E. And, the doctor will say, well, did you have a heart attack? Sometimes people will have a silent heart attack and not know it. So they can tell that you've had a heart attack in the past if your ECG looks like this. They just don't know when. So, it's sometime within the last couple years. But that's actually fairly common, that someone could have a small heart attack, survive it, and not know that they had it. But typically if people are having heart attacks, that's often going to be picked up. They're going to go to the ER and they'll take that very, very seriously. So do know the difference between the normal and what the acute heart attack, myocardial infarction, MI, what that looks like. So again, it looks very, very different. The ST segment is elevated.